So David Kleiman here with the EMS Operations Division. I'm very excited today to go through a fantastic app that Cobb County Fire got for everybody in the field. With the Handtevy app, we're allowed to do it as individual users, but the county iPads aren't registered to a single individual, so as of right now, we're working through it with Handtevy where we can get it onto our iPad. Make sure you only put it on your smartphone devices, not on any county iPad yet. So what is the hardest call that you're going to run as a firefighter? It's a pediatric call, because you're going to have to end up figuring out either the age of the patient, the parents are going to tell you a weight, you're going to use the Broslo tape, you're going to try to figure up pounds to kilograms, then you're going to figure up a drug and say, well, now I'm doing a kilograms times the milligrams, and then you've got to figure up milligrams to mLs. A lot of math, a lot of potential for error of either underdosing or overdosing that patient. And the Handtevy app is going to make it so much easier for you to do type of medications, and it's going to give it to you in volume. It's going to take all that extra stress out of you trying to figure out the math on scene. I'm going to show you guys how to install and download and actually log into the Handtevy app. Remember, once again, this is only going to be for your personal cell phones and your personal smart devices. So depending upon if you have an Android or an iPhone, you're either going to go to Google Play Store for the Android or for your Apple Store. Once you're there inside the Play Store, what you're going to do is you're going to go to your type bar to search for the app. And what you're looking for is the Handtevy. So you're going to type in Handtevy, and you're specifically making sure you look for the blue Handtevy sign, the blue hand sign. Once you find the correct Handtevy app, you're going to install it. This is going to take just a few minutes to install it. So now that it's actually installed, you're going to go over to the Open button. You're going to open the Handtevy app. The Handtevy app is actually going to come up, and then once we go through our proper login sequence, including the username and the password, you're actually going to be able to download all of the Handtevy that is specific to Cobb County, including some extra little features that we've actually added in there. We've actually got all of our protocols. We've actually got condensed drug forms. So you're going to put your first name in, your last name in, your agency, as in Cobb County Fire and Emergency Services. You can simply put CCFEMS or CCFES. The employee ID is optional. You do not have to do this, but you do have to do your email, your Cobb County email address. Once you have that done, you're going to push the register button, and that's going to be adding you into the add installation. Your username is going to be CCFEMS 5217 in all capital letters. Your password is going to be the same thing. You're going to click Add, and at this time you're going to agree to the disclaimers, and it's going to download all of the files that are specific to Cobb County. So as you're downloading, the flashlight permission is going to come up. What the flashlight permission is going to do is when you decide to push the CPR button, this will actually give not only a tone of when to do compressions on the child, but it will actually access your flashlight and give you a flash indicator. I recommend just skipping this so you don't have a little bright light flashing. So the Handtevy app has been downloaded on your phone. You've registered it. You've agreed to the terms. And what's going to happen now, when you go down that route to that pediatric arrest or that pediatric call, you're going to pull out your smartphone, you're going to click the Handtevy app, and the first thing that's going to come up is this screen. I recommend, based on that MDC, when you're en route to that call, somebody in the apparatus pull up your app. You're going to look at the MDC to find out the age. You're going to click the green button, and that's going to bring you up to your Broslo tape or your patient's age based off that MDC, and this is where all of those easy drug calculations that I talked about a minute ago are going to actually make sense. It's going to be so easy, and I'm going to show you that. You go everything from preemie and all the way to the very, very bottom. We have 2 adult patients for you. We have a 75 and 100 kilograms. So we did put 2 adult patients in here to try to make it easy for you. But let's just say we're en route to a 7-year-old, and that's based off the MDC. We know we're en route to a 7-year-old. Or if you get on scene and that parent tells you, my kid weighs X amount, you don't have to go to the 7. You can actually go to the right kilograms. But in this case, let's say we're en route, we can actually push up the 7-year-old 25 kilogram. These are all in alphabetical order. So as you can see here, it starts with the Denison. The nice thing about Handtevy, as I said a minute ago, instead of you figuring out pounds to kilograms, kilograms to milligrams, milligrams to mLs, Handtevy did it simple for us. The only thing you need to check before you go and give this medication is our concentration currently still the same? Now remember, with EMS division, sometimes the medications we get in, the concentration in the amount of volume is a little bit different. The EMS division is trying to stay on top of that and fix the app as the concentrations change enough. But in this case, let's say we're going to give adenosine. So we know that the concentration that we pulled out of our drug box is 6 milligrams and 2 mLs. Here is what makes Handtevy so wonderful. It tells you the volume. It's done the math for you. The volume I'm going to draw up is 0.8 mLs. That is the amount I'm going to give. And over here, it's going to tell you I can give it IV or IO. It does the math. I don't have to sit there on a piece of tape and figure out the drug dose, have my partner look at me. I just go, hey, we're giving adenosine, draw up 0.8, confirm I got the right medication, the dose, the right concentration. I have drawn up 0.8. Yes, I can give it IV-IO. That's for all of our drugs. Let's say we're working at pediatric arrest. Here's your amiodarone, your first dose for that 7-year-old. You come over, same amount of concentration. Yes, it's 150 into 3 mLs. And I come over here, I'm going to draw up 2.5 mLs, and I can give that IV-IO. It's as simple as that. And if you keep going straight down on your screen and look, it's going to show you a couple different things. One thing I want to show you, highlight, is this Epi 1 to 10,000. Certain medications are going to be in a black line to make you aware that the Epi 1 to 1,000 is your allergic or respiratory, but hey, in the black tells you the 1 to 10,000 is only for cardiac arrest. I come over, my cardiac arrest dose is that 1 milligram and 10 mLs. I come over, I'm going to drop 2.5 mLs, and I can give that IV-IO. If you're doing that allergic reaction, it's at 1 milligram and 1 ml vial. I'm going to give 0.25 mLs, and that's going to be IM. The next thing I want to show you, particularly on your pediatrics, is if you scroll up, you're going to see some medications in red. When you see a medication in red, it's going to say, in this case, it's ketamine, and in parentheses, CMC. CMC means call medical control. This drug's in red means you have to call it. Underneath it, it's going to say we're giving ketamine for pain, electrical, or post-intubations. It's going to come over and say, this is our ketamine dose, 500 milligrams and 5 mLs. That's the concentration in the vial. You need to call medical control. And I'll show you somewhere else where you can show you what the volume is you're going to give. But it tells you you need to call medical control. And if they give approval, you can do it IV, IO, or IM, depending upon which route that you're trying to get it for the patient. If you keep looking down, we have all the medications, Versed for like post-intubation, seizures, combative patients, and it goes all the way down to our last drug, the racemic epi. Once again, the medications, if it's black, hey, that's a different type of concentration. Make sure you're getting the right one, the 1 to 10,000 versus the 1 to 1,000. If it's red, you're going to call medical control. Once again, confirm your concentration, but more importantly here, your volume is the volume of the medication you're drawing up to administer. So let's say I go to give lidocaine for that VFib, VTAC arrest. This app is actually going to say when you give them medication, it's going to do a time, date, and stamp for you, so when you go do your report. So let's say I'm going to give the lidocaine. I'm going to click on the lidocaine. It's going to bring up this box, and you can actually say IV or IO. This is the volume I've administered. If it's ketamine, you're going to say requested. In this case, I have given it. You push it, It turns green. That means I've given a dose of lidocaine. The next time around, if I give another one, same thing. You just click it, administered it. It's that way with any drugs. Let's say I go to do the Versed on the post-intubation. I click it, comes up here. Let's say this one I went IO. I gave it. That is how you administer the medications. So let's talk about some of the buttons on the bottom. So we're en route to that call. Remember, like I said, you're going to pull up that app. You're going to be saying to your partner in back, hey, T-Roy, you're going to be doing the IOs this time. So what I would do is I'd go to the bottom and click Equipment. The equipment tells you everything we need to know for that pediatrics. On the nasal cannulas, it's going to tell you everything. The important thing here is it's going to tell you the size blade, the size endotracheal tube, the right size suction catheter, if you're getting down to the IV catheters or IOs. So here, it's going to say for a 7-year-old, we're going to use a 5.5 uncuffed tube. If we're going to go down to, I don't know, let's just say the IV catheter, hey, you can use a 20 or 18 gauge on this patient. If you're doing the IO, we're going to have either the pink or for Cobb County, the 25 millimeter blue needle. So en route, whoever's your IV guy, you can actually tell them, hey, so this is the size catheter you can use on this patient. If you go to electrical, it'll actually tell you your defib joules. So my first shock is going to be 50, the next shock is 100, 100, 100 after that. Let's say I'm on a cardioversion the kid. It's got all the math figured out for you. I'm going to do my first cardioversion at 30, the next one at 50, 50, 50. If you go to vital signs, it'll actually tell me what the normal systolic blood pressure is, the normal MAP, the heart rate, respiratory rate, and it'll give you all that information. So as you're en route, you sort of already know this should be my vital signs I'm looking at. Or when you get on scene, if you go, is that normal or not? You click on vital signs. When you click on drips, it'll actually tell you, hey, we're going to start an amiodarone drip. It's going to tell you the amount of volume of the medication in a 100 cc bag, and it's going to tell you how many drips over 20 minutes. Let's say I'm going to start an epi drip on the kid, right? I got 10 milligrams in an ml. I'm going to do 1 ml in 100 cc's, and that's going to give me 12 drops per minute, titrate to effect, 60 drops in an ml. It's going to tell you everything on how to mix your drip rate, and anything specific on that drip set for you. If you go to meds for the 7-year-old, it brings you right back to this screen that you were on. Remember, as soon as you click on the button, you choose your age, it's going to bring you up to the screen, and you go in alphabetical order to the drugs that you need, confirm your concentration, it will tell you your volume administered. On the bottom, all your drips are already figured out, any type of equipment specific to that patient's age. The electrical is going to be your cardioversion or your defibrillation, and your vital signs are going to be the normal ones for that patient. So now we're going to talk about the last feature that's on that 7-year-old 25 kilogram. You're going to see on the top of yours in a big orange stripe, start CPR. If this is an arrest, for example, when I hit start CPR, it's going to come up to this screen. You're going to be telling it, am I doing a 15 to 2? Am I doing a 30 to 2? It's going to tell you when to ventilate, or continuous CPR. So you just click, and remember, this is doing a timestamp for you. You have a reset button. If for some reason you pause longer than whatever you feel necessary, you can restart it. Over here, you have 2 simple buttons. You can say when I defibbed the patient, when I gave the epi. Simple, straight up screen. But you're going to notice immediately off of your thing, you're going to have a monotone. Remember I said turn off the flashlight, because if you turn off the flashlight, you're not going to have a bright light in that monotone. Do we really want to hear all of her talking about CPR or ventilate and stuff? No. So what you do is you click the ventilate button, and that's going to bring you up to this screen. So here, if you notice, you can enable all of your sounds. You can turn off your ventilate sounds. You can turn off the ventilate light. You can change your monitor sounds. You can turn off the sound for check rhythm, and you can turn off the buttons for reset. So you can turn off everything here that you want for CPR. Once you get stuff set up the way you want, you can simply close it. That is the orange button at the top for CPR. And like I said, continuous. My patient's intubated. We're doing continuous CPR. We're not stopping 30 to 2 or 15 to 2. And like I said, you can actually click the defibrillation or epi anytime you want. If you click the defib, once again, it's going to give you a drop down. You're going to tell it what joules and shock delivered or no shock. So we shocked them. You can click on the epi. It's going to tell you, hey, this is your dose and volume once again. Did we give it IVIO? And we're going to click the button when we gave it. So your ambulance provider shows up on scene. You gave that patient report. You've turned the patient over to the ambulance provider. At that time, make sure you click Stop CPR, and that's going to give you an outcome. Hey, we got a ROSC in the field, ROSC in the ED, ongoing resuscitation by other, which would be your ambulance provider, ongoing resuscitation in ED. If you feel like it, you can click any of the buttons or you can skip this step, whatever you feel that you need to. You click whichever one you need, and then you click OK. All right. So currently right now, it has wiped away everything that I just currently did for that patient, getting you ready for the next patient. Back to the station. You're going to click down here. You're going to go to Patients. And this is the patient that we ran. The Submit button, which we're not using right now, the Submit button is actually going to hopefully eventually upload it to the cloud and pull it right into ImageTrend for you, and it's going to populate stuff. ImageTrend and Handtevy are talking right now, so we cannot use that button. But if you go to Edit and you start scrolling down, you'll actually be able to see these are the drugs I gave. You can actually click on it. It will actually tell you the times. And there's my time that it was given. So when you're doing your PCR, you'll still be able to track, this is when I gave the epi, this is when I shocked somebody, so you'll still have a time stamp. Please, please download this app, play with it, get very, very familiar with it. It will make your life easier.